Gentlemen, if you're a man over 60 and you're looking to significantly boost your erectile strength and overall male vitality, listen closely. As a urologist, I'm about to reveal a simple 3-minute daily exercise that can genuinely help you reclaim that confidence. This isn't about quick fixes or magic pills. It's about a proven, science-backed approach. So stay right there on Men's Health Channel. We're diving into exactly how you can maximize your intimate health for years to come. Welcome back. In all my years as a urologist, I've learned that a man's confidence often goes hand in hand with his overall well-being, and sexual health is a huge part of that. It's completely normal to notice changes in erectile function as we age. And let's be honest, many men feel a sense of frustration, even embarrassment when these changes occur. But I want to reassure you, you are not alone. There are concrete, effective steps you can take. You see, factors like blood pressure, diabetes, cardiovascular health, stress, and certain medications can all play a significant role in erectile function. It's a complex interplay of your vascular and nervous systems. Today, I want to introduce you to a foundational element of male pelvic health that often gets overlooked. Your pelvic floor muscles. Think of them as the unsung heroes supporting your bladder, bowel, and yes, even your erectile function. Strengthening these muscles through simple, targeted exercises can lead to remarkable improvements in blood flow, nerve function, and overall erection. This isn't about anatomical size, which can't be increased through exercise, but about maximizing the health and performance you already have and ensuring those vital systems are working at their best. The exercise I'm talking about is commonly known as a Kegel exercise. For years, Kegels were primarily associated with women after childbirth, but men, I cannot stress enough how absolutely vital they are for your health, too, especially for urinary control, prostate health, and, as we're discussing today, erectile. First, you must identify the right muscles. Imagine you're trying to stop the flow of urine midstream or prevent passing gas. The muscles you tighten and lift are your pelvic floor muscles. A common mistake is to tense your abdomen, thighs, or buttocks. Don't do that. It's a subtle internal squeeze with an upward lifting sensation. You can practice this sitting, lying down, or even standing. Once you're confident you've isolated the muscles, you're ready to begin. The 3-minute routine is quick, easy to fit into your day, and very aim for 3 minutes once a day at your desk, in your car, or while watching TV. Step 1. Slow hold 1 minute. Gently contract and lift your pelvic floor muscles, holding for 3-5 seconds. Then relax completely for the same amount of time. Repeat 10 to 12 times to build endurance and control. Step 2. Quick flick. 1 minute. Rapidly contract and relax your pelvic floor muscles, like a light switch turning on and off. Do this for 1 minute, ensuring a full release. This builds quick reflexes for firmer erections. Step 3. Endurance. Hold 1 minute. Contract and hold for as long as comfortable. Start with 10-15 seconds, then relax fully. Repeat 3 or 4 times to build stamina. How does this help? Strong pelvic floor muscles, especially the bulbocavernosus and ischiocavernosus, act like a powerful pump. During an erection, blood flows into the penis, and these muscles compress the veins to trap it there. This is called venous occlusion and is essential for maintaining firmness and duration. A stronger pelvic floor leads to better firmness, improved sensation, and enhanced control. It can also help with bladder control, dribbling after urination, and even premature ejaculation by giving you more command over the ejaculatory process. But avoid common mistakes. Don't bear down or push, always lift upward. Don't hold your breath, breathe normally. Don't tighten your abs, glutes, or thighs. Focus only on the pelvic floor. And don't over routine to avoid fatigue or strain. Finally, remember, Kegels are powerful but not a magic cure for every issue. If you have persistent erectile difficulties, severe urinary problems, pain during erections, or pelvic discomfort, consult your doctor or urologist. Underlying issues like heart disease, diabetes, nerve damage, hormonal imbalance, or prostate problems may need professional attention. Taking control of your health, even the parts we don't always discuss openly, is a combine this simple 3-minute habit with a balanced diet, regular cardio exercise, good sleep, and stress management for the best results. If this message has empowered you, hit like, subscribe to Men's Health Channel, and turn on the bell so you never miss practical, science-backed tips for men over 60. Drop your questions or suggestions in the comments. I read every one, and your ideas often inspire future videos. In my very next video, I'll cover another vital topic: prostate health, when to get screened and why it matters. You won't want to miss it. Stay informed, stay healthy, and keep taking charge of your well-being.